What do you say to somebody that says, I've tried the patch, I've been on it for 3 days, could be a week, could be a month, I don't feel anything. Is there something going on with them? Because everyone that I've seen diligently be on the X39 has been getting results. Can you tell us what's going on, for maybe a simple answer for them to help their friend if they are just skeptical, not cynical, but skeptical?
Yeah, so absolutely. So at this point, we've done over 80 clinical studies over the last 20 years on the products. And so when someone says they have not experienced an effect, there is going to be an extremely small percentage of people. I mean, we're talking about 3 or 4% of the population that will not get an effect. Now, that effect is measurable. So if we have 96 or 97% of the population responding, that means it's measurable scientifically. That could be through a blood test, a urine test, bioelectrical test, and so forth. So in our studies, which we publish and which hit statistical significance, it means, let's say in the case of X39, is that we measured levels of copper peptide in the blood, and we were able to see increases in those levels of copper peptide. That doesn't mean you feel it, but statistically we can say that with confidence. So then we follow that up with another study such as a urine test, and we're going to measure the metabolism. So we look at how is the body utilizing amino acids, what hormonal changes might we see with X39, and those things also we hit statistical significance. We also use clinically relevant questionnaires, and we ask people, how do you sleep, how do you feel, overall wellness, and again, we see statistical significance. So the answer to this is that first, when people use the product, the odds are that it's making a change. They may not necessarily feel it.